The next cancer we'll discuss is breast cancer, and as you can see on this slide, the United States, Canada, the UK, and Australia have the highest rates of breast cancer. At the end of this PowerPoint, take a moment to think of reasons why that might be and what the other countries might have in common that is protective. Breast cancer is the most commonly occurring cancer for women, and second only to lung cancer as the leading cause of death in women. If breast cancer is found early as a localized cancer, the 5-year survival rate is about 98.6%, but survival drops drastically with any kind of metastasis. The main parts of the breast are the lobules, which are the milk-producing glands, and the ducts, which are the milk passages that connect the lobules with the nipples. Adult women have usually about 15 to 20 lobes in each breast, and the breast cancer primarily affects the ducts carrying the milk or the lobules, which make the milk. The vast majority, 80% of breast cancers, are the invasive ductal carcinomas that penetrate the surrounding tissue. Breast cancer metastasizes through either the blood or the lymphatic network, and the most common sites for metastasis is first the lymph nodes, then the brain, lung, bone, and liver. This slide shows percentages of breast cancer sites, and the upper outer quadrant is the most common tumor site due to increased glandular tissue. Inflammatory breast cancer is a special type in which the cancer cells have spread to the lymph channels in the skin of the breast. This type of cancer accounts for about 1 to 3% of all breast cancers, but it has a higher chance of spreading and a worse outlook than the typical invasive ductal or lobular cancer. Inflammatory breast cancer is always staged at stage 3B unless it has already spread to other organs at the time of diagnosis, which would make it a stage 4. The skin of the affected breast becomes red, swollen, and warm, and may have the appearance of an orange peel. This slide shows that there are other types of breast cancer, but the main ones are the invasive ductal and lobular. Cells within the breast cancer will be tested to see if they are hormonally driven. About 80% of breast cancers are estrogen driven, and then about 65% of these are also progesterone driven. Another driving process is the HER2 protein, which in the healthy breast is responsible for repairing the cells and growing new cells. But in about 1 of 5 breast cancers, an excessive amount of the HER2 protein is present, and it becomes a driving force of the cancer. In treating breast cancer, it is important to identify these driving forces because the medications and therapies will target these processes with anti-estrogens and anti-progesterones. The greatest risk factor for the development of breast cancer is to have had a previous episode of breast cancer. So that would be of great concern for any woman who is in, quote, remission. Other risk factors are increasing age, such as over the age of 40, early menarche and late menopause or nulliparity, absence of breastfeeding, family history, high-fat diet, obesity, alcohol use, hormone replacement therapy, breast biopsies, and environmental estrogens, such as that which is in BPA, which was in all of the plastics until recently, and this FPOA is in our non-stick pans like Teflon type of cookware, and then DDT, which is in our insecticides. There's been recent controversy about teaching women to do breast self-exams because there are a lot of false positives. Women will find small lumps, and the doctor will do a breast biopsy that returns negative. And remember that the breast biopsy itself increases a woman's risk for the breast cancer. The current emphasis is on personal breast awareness and away from the breast self-exam. But if a woman is at high risk and wants to do these exams, we need to teach her to set a consistent monthly date for performing the exam and show her how to examine her breast and have her do a return demonstration. A complicating factor for the self-breast exam is that most women have fibrocystic breast. This is a benign condition of fluid-filled, movable, round, and well-circumscribed cyst in the breast. and it is hard to tell the difference between these and an early breast cancer. Clinical breast exams are recommended every year and are to be performed by an experienced clinical practitioner. Baseline mammography is done typically between the ages of 35 and 40 and every year after the age of 40. Mammograms can detect tumors 2 years before they reach a palpable size, and it is said to be low-dose radiation exposure. Signs and symptoms may include a mass or thickening in the breast or axilla, a non-tender lump that is non-mobile and most often in the upper outer quadrant of the breast. Nipples may have discharge, retraction, or crusting. Breast contour may change, or there may be swelling, dimpling, or puckering of the skin, or an orange peel appearance of the breast skin. Diagnosis can be made by either aspiration, which is by needle biopsy, incision, which removes a portion of the lump, or excision, which removes the entire lump, or with a sentinel lymph node dissection, whereby dye is injected and traced into the first lymph node that would be the most likely to contain cancer cells. If that is positive, then an axillary node dissection would be done, which removes 12 to 20 lymph nodes to view microscopically. Chances of tumor regression are significantly greater in women whose tumors contain the estrogen and progesterone receptors. Tamoxifen is an anti-estrogen and the first line of defense, but side effects include decreased visual acuity, corneal opacity, retinopathy, and possible early Alzheimer's, as estrogen is neuroprotective. Radiation can be internal or external, and chemotherapy is given if there's any evidence of a systemic disease, such as axillary node involvement, and to prolong a woman's life if metastasis has occurred. The main drug used is adriamycin, which can cause cardiotoxicity with heart failure and dysrhythmias. There are a variety of surgical procedures, from minimal to everything goes. A lumpectomy involves a simple excision to remove the tumor and a margin of normal tissue. This is usually followed up with radiation to the entire breast. A simple mastectomy removes breast tissue only, and a modified radical mastectomy removes breast tissue and the axillary lymph nodes, but it preserves the pectoralis muscles. And a radical mastectomy takes breast tissue, axillary lymph nodes, and the pectoral muscle. Reconstruction can actually be done at the time of surgery or at a later date.